All right, welcome back, good people. On this video, I'm going to be talking about heart disease and stroke. That's right. What I want you to understand for this video series, this week's video that I'm creating, is I want you to focus on your health. I want you to think in terms of your health. Where are you from a health perspective, a health standpoint right now? Because you can always get better, right? And if you're not in bad shape right now, you have to maintain that. And chances are, if you're a senior citizen, which this information is basically for people who I market my information to, what I consider the baby boomer generation, people who are either retired or preparing to retire, or have 5 or 6 years before they retire, that they want to start their own little business. Maybe they've always wanted to have a business, but maybe they haven't. Maybe it's just something that they decided they wanted to do now, right? Now that we're in the 21st century and things are so easy to do, and it's actually so necessary to have like what you consider a side income, right? Something that you can do and enjoy doing and make a little money from it. And perhaps if it gets really good, it could replace your job, right? Or it could allow you to retire earlier in life. Right? Because we all want to retire at some point, right? We're not just working in our mind forever, are we? Not at least working for somebody. So if you could see yourself having your own business, if you could look outside of being an employee for life, right? Which, people like my mom and my dad, they were employees for life because they really had little knowledge of how to start a business, or which also led them to have a little interest in starting a business, right? But now with the internet and everything being so accessible and so inexpensive, now is a great time to actually put your mind there. And all you have to do is learn a few things, follow a few steps, right? It's not like it used to be. You don't have to spend a lot of money up front, not necessary. You don't have to spend a lot of time up front, not necessary. However, you will want to spend more time because it will interest you, because it's in line with what you like, right? So imagine me telling you to go study something that I like and you have no interest in it. It would be hard for you to get up for that. But if I tell you to go study something that you like, then it's not difficult. You like to do it, and you're gaining from it. You're gaining perspective. You're gaining understanding. You're gaining insight, because those things are important. A lot of times when we're talking about starting a business, because I talk with a lot of people about starting a business, and they want to start a business, but they don't want to put the time in to learn the business. You got to get that. There's a shift, right? There's a big difference in wanting to and actually doing it. Big, humongous. But it can be done. But it can only be done by you. I can't do it for you. So if you don't have the drive, the desire, the real interest to do that, you're not going to do it, because you'll always make excuses why you shouldn't do it, why you shouldn't study, why you shouldn't take action on some things that you've learned. You'll make excuses for that. That's called self-sabotage, right? You'll sabotage your success simply because you don't want to take the action. You're afraid, but you're saying it's always something else that's holding you back. You start to blame people. You start to blame situations. Situations, you cannot allow those to hold you back. Those are like experiences. You have to go through those, get those, and keep it moving, right? If you're able to do that, because you see people who do that all the time. You know what's required with that. You see that, and you know if you're lacking in that area. You know you don't have the discipline yet to go through that, right? But you can do it. It's not like, nobody's better than the next person. It's simply that you're willing to take the bumps and bruises that come with that. Because a lot of times people are going to point the finger. They're going to give you negative feedback, talk negatively about you. That's got to be okay with you. You got to develop a thick skin. We're talking about something that's going to allow you to live your latter years the way you want to, right? Let's say you invest 5 years in a good business just from nothing. You don't even have a business mindset yet. And all of a sudden you begin. Just imagine it. It's possible that 5 years from now, within 5 years, your business could be sustaining your lifestyle. That's possible. It's doable, but it requires you. So if you're not willing to put you in it 100%, it won't happen. Right? All right, I'm going to start off with that. Then I'm going to talk about the heart disease and stroke information, because none of that's possible if you having all this going on, right? Because your interest kind of dissipates. So listen up. Heart disease. Heart disease is the leading cause of death for people of most ethnicities in the United States, including African Americans, Hispanics, and whites. About 610,000 people die of heart disease in the United States every year. 610,000. That's 1 in every 4 deaths. Heart disease is the leading cause of death for both men and women. More than half of the deaths due to heart disease in 2009 were in men. Coronary heart disease, or CHD, is the most common type of heart disease, killing over 370,000 people annually. Every year, about 735,000 Americans have a heart attack. 735,000. Of these, 525,000 are a first heart attack, and 210,000 happen in people who have already had a heart attack. A heart attack happens when the blood supply to the heart is cut off. Cells in the heart muscles that do not receive enough oxygen carrying blood begin to die. The more time that passes without treatment to restore blood flow, the greater the damage to the heart. About 15% of people who have a heart attack will die from it. Almost half of sudden cardiac deaths happen outside a hospital. Having high blood pressure or high blood cholesterol, smoking, having had a previous heart attack or a stroke, or having diabetes can increase your chance of developing heart disease and having a heart attack. Symptoms of a heart attack. Number 1, chest pain or discomfort. Most heart attacks involve discomfort in the center or left side of the chest that lasts for more than a few minutes, or goes away and comes back. The discomfort can feel like uncomfortable pressure, squeezing, fullness, or pain. Number 2, discomfort in other areas of the upper body can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Number 3, shortness of breath often comes along with chest discomfort, but it can also occur both before chest discomfort. Number 4, other symptoms may include breaking out in cold sweat, nausea, or lightheadedness. Remember, if you think you or someone you know is having a heart attack, you should call 911 immediately. Now, a stroke. Stroke is the 5th leading cause of death in the United States and is a major cause of serious disability for adults. About 795,000 people in the United States have a stroke each year. 795,000. You can help prevent a stroke by making healthy choices and controlling any health conditions that you may have. During a stroke, every minute counts. Fast treatment can lessen the brain damage that strokes can cause. By knowing the signs and symptoms of stroke, you can take quick action and perhaps save a life, maybe even your own. Now, signs of stroke in men and women. Number 1, sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Number 2, sudden confusion, trouble speaking, or difficulty understanding speech. Number 3, sudden trouble seeing in one eye or both eyes. Number 4, sudden trouble walking, dizziness, loss of balance, or lack of coordination. And number 5, sudden severe headache with no known cause. those are signs of a stroke. Now, you see, that information is invaluable if you've never heard it. And if you have heard it, it's invaluable for hearing it again, right? Because a lot of times we need to be refreshed on certain things, right? Especially when it comes to our health. Because one of the things about health is that when you're diagnosed with something, it kind of scares you, right? It scares you kind of, straight, if you will. It's kind of confusing in a lot of cases, I believe. I hadn't really had that firsthand, but I've heard stories of people, and I ask questions about things because I believe that's how you get answers. And just because you experience a certain thing and respond in a certain way doesn't mean that I would do the same thing, right? You may hear, well, you need to stop drinking or something, right? And stop drinking. I may hear that and continue drinking. Or you may hear, you need to stop smoking and stop smoking. And I may hear it and continue smoking, right? We respond differently, but the consequences of our choices are there just the same. So if the doctor tells you you need to think about stopping this activity and you continue on, you heard it. You know the consequences with that, right? But we have choices, right? We're all going to go that route. So if you choose to continue on, when the consequences come, so be it, right? You have been forewarned. And that's the beautiful thing about this thing called life, right? We have choices. We can decide, yes, we're going to do that, or no, we're not going to do it. And we're only people that are going to hold us responsible is our actions, and is ourselves, is our response to that. So if you can deal with that, that's the way you lived your life. And that's a good thing. All right. Don't forget to share these videos, like these videos, and I'll see you on the final video this week, which is Speak with Larry's Quotes. This is week 7 coming up. See you then.